Good afternoon. Whoa, it's a live microphone. Good afternoon, everyone. My name is John Carney. If you live in Delaware, I'm your governor. Welcome here to the Route 9 Library, and to welcome us is our county executive, Matt Meyer.
Thank you. Good afternoon. You know, Governor, you picked the right day to celebrate the quenching of thirst. It's fantastic to be here. Welcome to the Route 9 Library and Innovation Center. It is a monument to what partnership between state, county, and community can do, and a monument to the tremendous service that we provide the public every single day. I wanted to remind everyone, we have a farmer's market today at 3 p.m. right out front there, and if you walk in the other direction, you'll see a garden that we're starting to grow so that people right here on the Route 9 corridor, kids have healthy living every single day. If you were here 4 years ago, there would be no building here. You'd be in an open lot. So it's great that we're here today, and we're really honored that you've decided to sign this bill at the one eatery at a library in Newcastle County. So thank you so much, and welcome everyone.
Thank you to our county executive. This is a wonderful facility. When I was lieutenant governor, you know, the lieutenant governor is always in charge of the weather. Our Lieutenant Governor Bethy Hall-Long is not here with us today because she's hosting the National Association of Lieutenant Governors, about 25 of them, which are gathered here in our state today and touring around and having conferences. I'm delighted to be here to sign House Bill number 79 as amended by House Amendment number 1 and House Amendment number 2. I think it's appropriate that we have the children here with us because this is what the bill is all about. We're joined today in special guests. We have members of the Delaware State Senate, Senator Sokola, Senator Townsend, and Senator Lockman. Thank you for joining us. We also have Representative Kendra Johnson, who I think is directly behind me, Representative Paul Baumbach, and Representative Frank Cook. This is actually your district. This is your district, just outside of your district, as I understand. And we also, where's Miss Lola? We also have Miss Lola and her children, which are down here in front. Miss Lola's early care center is just down the road in Representative Minor Brown's district. We're also joined by members of Wilmington City Council, my Councilman Trippy Congo, Councilman Vash Turner, and Councilwoman Rahima Dixon. Thank you for joining us today as well. I spent 8 years as Lieutenant Governor, and one of the programs that we worked on is what we call the Lieutenant Governor's Challenge. And the idea of the Lieutenant Governor's Challenge was to get Delawareans, and young people in particular, to be more physically active and to eat a healthy diet. Our bill signing today is all about the second part of that, which is eating a healthy diet. And I'll leave the details over to Representative Minor Brown. But it is a really, really incredibly important challenge and issue for our state. We are seeing rates of folks being overweight and obese in greater than we ever have in our past, and that has really serious negative implications for people, particularly as they age and are subject to type 2 diabetes and other poor health conditions. So getting children to start out on the right foot is a really, really important objective, and that's what this bill is all about. It will be my pleasure and privilege to sign it, but right now to speak a little bit about the details is Representative Melissa Minor Brown, Mimi Minor Brown, to all of us, who's the prime sponsor in the House.
Thank you, Governor Carney. Good afternoon, everyone. Thank you so much for being here to witness the signing of House Bill 79, a bill that is going to change the default option on children's menus from soda to a healthier option. First, I want to thank everyone who helped me get this bill passed, who helped this bill get here where it is today. And that is the American Heart Association, Jonathan Kirch, Louis Phillips, American Academy of Pediatrics, Dr. Lawler, DHSS, Division of Public Health, Helen Arthur, Matthew Gooch, Nemours, Christiana Care, St. Francis, the American Cancer Society, Jenny Chacoin, Cancer Action Network, League of Women Voters, Westside Health, YMCA, Medical Society of Delaware, Drew Wilson, Delaware Dental Society, Dr. Harris, Dr. Kelly, Delaware Nurses Association, Delaware Association of Physician Assistants, Delaware Dental Hygienists Association, the Delaware Chiropractic Society, and Lola Mayo with Passion Care Academy. Thank you for your dedication to children's health. Also, I have to thank the American Beverage Association for making sure people have options when they walk into a store, not only a sugary drink, but options that suit their needs. Let me not forget the one person who championed the Wilmington Ordinance last year to remove sodas from children's menus in Wilmington restaurants. That is City Councilman Vash Turner, along with co-sponsors, City Councilwoman at Large Rashima Dixon and City Councilman Trippy Congo. Thank you. You guys and ladies have championed this in Wilmington, and now we've extended it to Delawareans across our state. This legislation is so important to me from my perspective as a mom and as a nurse. The amount of junk food that's aimed at young children and infants every day should offend all of us. As parents, it's our job to help guide our children and help them make healthy choices. But when you see that children are consuming an entire bathtub of sugar every year, which is equal to 30 gallons of sugar, that's a problem and something's wrong. So now we're faced with these public health epidemics like diabetes and obesity and heart disease, and they're cutting Delawareans' lives far too short. Diseases that root in our children at a young age from decisions that are being made for them. So with this obesity epidemic continuing for Americans young and old, it's obvious that we need to do something, and we need to educate residents of Delaware on the toxic effects of sugar and what we can do to decrease that. This bill is not the sole answer to this problem, but it is a small, important step to help us get to where we need to go to address these public health issues. In closing, I just want to say that this legislation will save lives. This legislation will save their lives. This legislation will allow them to have a future, a successful future, a healthy future. So thank you so much, everyone who came out to support this legislation. I'm so excited. Thank you, kids. Thank you.
Thank you very much, Representative Minor Brown. And you're exactly right. This is one small step, a very, very important step, as it deals with diet and consumption of too much sugar and obesity and diabetes and all those issues. But there's a lot of other things that we have to do, and we look forward to working with everybody here in front of us, members of the General Assembly, members of county government and city government, on addressing this issue. Senator Townsend is the chair of the Senate Health Committee. Would you come forward and share a word or two?
Good afternoon, yes. Good afternoon, everyone. Pleasure to be here, pleasure to support this legislation alongside Representative Minor Brown, Senator Lockman, Senator Sturgeon, and all of our colleagues. As the chair of the Senate Health Committee, just wanted to say we're going to continue to take steps to try to make sure that you can be as healthy as possible. We want to take steps to make sure that our entire community is stronger by being healthier. The statistics are stunning. Where we are as a community, where we are as a society, all the way up to literally military preparedness. And the fact that we aren't as healthy as we need to be to have as strong a community, as strong a country as we need. This is the second bill this week that's been in the news, both involving myself and Representative Minor Brown, so I guess beware. That involves changing laws that have to do with some of the options that people have. But we've got to be honest that we can't just stop at the idea that this changes options or impinges on liberties. We have to be honest about the cumulative effects of these decisions in our community. And when people fall ill, whether it's a little cold that you might get at school, right? Sometimes I know you get colds at school. Whether it's very serious illnesses, whether it's people need treatment coming back from serving in the military, whether it's some of the healthcare needs that come with older age, it can be very frustrating and challenging to know that we've got to compete for health resources for treatment of conditions that we could have avoided by making healthier options. And I think we all know that most of us don't always do the healthiest thing possible. But when you're talking about situations that affect kids, when you're talking about Now we know, and Representative Minor Brown used the word toxic. I mean, literally, the toxicity of sustained exposure to sugar, we know that we can do better. And when we're talking about little kids who aren't necessarily the ones and almost always aren't the ones truly making that choice, whether it's because a quick option that parents might select or the very targeted advertising that manufacturers and distributors might try to implement. The point is the status quo is unacceptable, especially to our kids. And we've got to be honest about that and do as good a job as we can do to make sure that healthy options are there and that ultimately health is there. So kids, we've got your back, Representative Minor Brown, Senator Lockman, and all those of us who support them. We've got your back. Be healthy, be happy, do the best you can do. Thanks for being here today, and thank you for all the stakeholders that Representative Minor Brown listed off. We can't make this progress without you. Thank you all so much.
Thank you, Senator Townsend, and thank you for your leadership on the Health Committee. Just an additional recognition that Senator Lockman was the co-sponsor, lead co-sponsor in the Senate. Senator Townsend said something that reminded me of a briefing that I had as your United States Congressman, and that is that the obesity epidemic is affecting our national preparedness. We get briefed by military leadership about the fact that their pool was shrinking because too few people were meeting the health and wellness requirements of admission into the military service. So that's an important objective here as well. Next to speak is Vash Turner, who's been leading the charge in the City of Wilmington City Council.
Thank you. Thank you. First and foremost, I'd like to thank God for putting us all in a position to be change agents, to impact the youth's lives and giving them education for its health. Second, I want to recognize two people. One couldn't be here, his name is Nicholas Brock. Nicholas Brock was the champion that did the research for this bill when we were in the City Council. Also, his research led to the state and to the state for them to pass this bill. So I definitely don't want to give Nicholas Brock his credit, because without him in the research, this wouldn't have been passed in Wilmington. Second, I'd like to thank Fred Reed from Reed's Refuge, because this bill got started because of their program that they do with the microwavable cooking with the microwave. The conversation came about how to make our kids healthier, and that's how the ball got rolling. Just want everyone to know that this is, like the kids say, this is a big thing. This is really a big thing, like the kids say. This has made us, with the state of Delaware adopted this bill, we are now the second state in the country that ratified this bill behind California. The city of Wilmington was the second to ratify it on the East Coast part of the city, and now we're the second in the state. So I thank everyone that took advantage of this and helped to put this in place. So I thank you, and thank you, Governor, for signing that today.
Thank you very much, Councilman, for your support and others of City Council. Before we bring advocates to add to this presentation, I would like to recognize Mary Ann Carter, who was at the beginning with us on the Lieutenant Governor's Challenge almost 20 years ago, who's been fighting this fight at the University of Delaware and Delaware State University. It's great to see you up and around, and glad that you're able to join us today. Next to speak, please. Mary Ann's been doing a tremendous job for a long, long time. Matthew Gooch, who's the CEO of Encompass Health in Middletown, Delaware.
Thank you, Governor. It's an honor to be here today. My name is Matt, as the Governor said. I'm the CEO of Encompass Health down in Middletown, Delaware. And there are three things, I was thinking about what to say today. There are three things in my life that bring me the most joy. The first of which is my job and seeing the way our staff are able to change lives day in and day out. The second has been the work I've been doing as a member of the Heart Association Board, seeing how the things that they do day in and day out change and impact positively the wellness and health of Delawareans and across the nation. The third thing that brings me the most joy are the three kids I have at home. Great kids, mostly well-behaving kids, although not as well-behaving as you all. I don't think my kids will be sitting this quietly for so long, so thank you very much. But as a parent, there are few responsibilities greater than ensuring that your kids are healthy and they make smart decisions. And as a family that likes to go out and eat a lot, I can say that I very much appreciate this bill, both for the short-term and long-term health of my children, for your children, for these young men and women here. So thank you all so much for the hard work that went into making this bill a reality. And as the governor said, this is the one small step towards ensuring the health and wellness of children across the state of Delaware. Thank you.
Thank you, Matt. And next up is Ms. Louie Phillips from the American Heart Association, who's been a real strong partner in this work for so many years.
Thank you, Governor Carney. I'm the current co-chair of the American Heart Association Policy and Advocacy Committee, and like Representative Minor Brown, I am also a registered nurse. I'm a mother, and I'm a grandmother. How wonderful. I spent my entire career devoted to improving healthcare systems in Delaware, and I have to say today is one of those highlights, so I thank you all for being here. House Bill 79 was a key legislative priority for AHA this year. The legislation provides a reasonable compromise to reduce healthy sugary drink consumption, particularly among Delaware's youngest children. Instilling healthy habits in our children is reinforced when our environment supports that effort. Saving lives, improving quality of life, and helping to control our soaring health costs must be a focus in Delaware. But of course, none of this is easy. It requires great courage to proceed forward despite the naysayers sometimes. It takes passion, commitment, and resilience in the face of great opposition to move Delaware forward sometimes. Ensuring that every child can get a healthy drink option when dining out with their family is a step in the right direction. So in closing, I'd like to thank Representative Minor Brown, Senators Lockman and Townsend for their passion, commitment, and resilience. And I'd like to thank all Delaware legislators who were supportive of House Bill 79. And thank you to the many individuals, agencies, and nonprofits who provided testimony. And thank you, Governor Carney, for your great support and understanding of Delaware's healthcare needs. Thank you very much.
Thank you, Ms. Louie. There are state employees who work on this issue of health promotion and healthy lifestyles on a day-to-day basis, and heading up that team in the Division of Public Health, the Office of Health Promotion and Disease Prevention, is Helen Arthur, who's our next speaker.
Thank you so much. Thank you, Governor Carney. Thank you, Representative Minor Brown. And I, as you heard, am the section chief for the Health Promotion and Disease Prevention section for DPH. And our office is charged with prevention and control of chronic disease and their associated risk factors. And so the work that we do is very important, and it's very important to our youth in the state of Delaware. So what we want you to know is promoting the best choices at restaurants can help families make healthier choices at home. Almost a third of Delaware children between the ages of 10 and 17 are at an unhealthy weight. And, you know, we really need to focus on that. So the research is very, very clear. Overweight and obesity are risk factors for at least 13 types of cancer. And these include breast cancer and colorectal cancer and stomach cancer and esophageal cancer. The list goes on, and the research is extremely clear. If we can reduce consumption of sugary drinks, we can lower prevalence of people being overweight and obese, and can ultimately reduce obesity-related diseases that can lead to a life of chronic illness. So on behalf of my leadership in the Department of Health and Social Services and the Division of Public Health, Secretary Walker and Dr. Rattay, who could not be here today, we want to say that we are extremely enthusiastic about House Bill 79 and what that means for our state. And we want to thank Governor Carney for making it his priority to reduce the impact of obesity as a way to improve health outcomes and reduce health costs. This legislation will go a long way towards supporting healthier communities, families, and a healthier future for Delaware's children. So thank you so much. Thank you.
Thank you very much, Helen. As the sponsors, each of the legislators, members of the House and the Senate, who are standing behind me, are sponsors of this piece of legislation, as I pointed out a bit ago.
You can never squeeze right in.
Speakers is Representative Minor Brown, who represents the district just south of here, was the prime sponsor in the House. It was also co-sponsored by other members of the House, Representative Cook and Representative Wambach. Prime sponsor in the Senate was Senator Lockman, who is right here behind me on the other side. You heard from Senator Townsend, who's the chair of the Health Committee, who works these issues. Senator Sokola is here as well. They were all sponsors. You heard about the City of Wilmington's initiative as well. Just for the children, the way this works, we're a piece of legislation to become law. It has to be introduced in one of the chambers in the legislature, pass the House or the Senate, wherever it starts, then move over to the other chamber, the House or the Senate, pass both chambers of the House, and then it comes to me to become law under my signature. That's how the situation works. We have a third branch of government. We won't get into that at the moment. But it is a real privilege for me, as somebody who's worked on the Lieutenant Governor's Challenge for so many years and who has a passion for making sure that our children are healthy and well, knowing that the future of our state and our country really depends on it, to really finish the work that these folks behind me have done, great work, a lot of work that remains to be done, as Senator Townsend pointed out, to sign House Bill number 79 as amended. And you can see I'm signing it with more than one pen, children, because we passed those out at the end.